So you're dealing with pain in your foot and ankle, and you're maybe asking yourself the question, what brace do I buy? In this video, I'm going to give you my doctor's guide as to which braces I recommend for what conditions. For those who don't know me, my name is Dr. Sonam, and I'm an interventional sport medicine doctor located here in Canada. Today, I want to review the different options available to patients for foot and ankle braces and what conditions I recommend them for. So the first and most common type of brace that you'll likely see for the ankle is a soft compression sleeve. So basically, you put your ankle in this and it provides an added level of compression. This model here also adds a little bit more support because you can actually then thereby also wrap it with some additional level of compression. So there's kind of two grades here. Usually you can just get a compression sleeve. This one also has that added strap. Now, how does this one work? So the strap provides external stability. We know that. The compression sleeve provides stability by providing medical grade compression. So when there's compression at the joint, the brain increases the proprioceptive awareness of the joint and space, which means that you're more aware of your ankle, which means that you're also going to stabilize your ankle better with the surrounding muscles. Now, specifically with this added strap also gives you that external stability to help tighten up the ligaments on the side of this ankle. What do we use this brace for? So this brace is used in mild ankle stability, some mild ankle arthritis, and some mild ligamentous injuries. So think, a mild medial ankle sprain, a mild lateral ankle sprain. This helps provide that ankle stability so that you're not rolling out or in your ankle too much. The other thing that this is really helpful for is if you have any swelling in the ankle, this compression sleeve will also help take out the swelling, which can also improve your healing times. A lot of patients will use this as a prevention. So if they're playing a lot of basketball or soccer and they want to help prevent having ankle sprains because those sports are riddled with a lot of ankle sprains, they'll end up using this during their sport. So another type of option available for ankles is a lace-up ankle brace. And I'm going to put a picture up to the side. So basically how this one works is you slip your ankle in and then you tighten up the actual laces to help provide a good amount of stability in the ankle. So when you're wearing a lace-up ankle brace, you actually you can't roll in or out your ankle at all. And you also have a hard time kind of toeing off sometimes. And, we call it dorsiflexion and plantar flexion of the joint. But it is one of the more stable options for those who are, for example, playing basketball and who've had a prior ankle sprain and who want to avoid re-injury. It's also really helpful in those with, moderate to severe ankle instability in the ankle, and they need that added benefit of support when they're hiking, they're walking, they're moving, and patients need that support. So this here is very similar to a lace-up ankle brace, but it's very specific for a rigid lateral stabilizer. So this here will actually stabilize the lateral aspect of the ankle. As you can tell, there's that compression sleeve here. You slip your foot in there. You also have an added benefit of the strapping system, but this here is your rigid splint. So it prevents the ankle from twisting in. So as you can tell, I can't twist it in. You still can actually twist it out a little bit, but you can't roll it in. And that is the most common mechanism of injury that causes ankle sprains. So sprains on the outside aspect of the ankle. So who would find this brace helpful? Because it's so rigid, this is very helpful in preventing re-injury. It can also be used as a post-op brace. Many patients will actually play their sport in this brace to help prevent lateral ankle sprains, for example, in soccer. And also it can be used in cases of, mild to moderate ankle arthritis. In a lot of these cases, these rigid ankle braces can also help people with joint issues at the ankle joint because it doesn't allow the ankle joint to bend and flex very much. So next we have an air cast, which I'll put a picture up to my sides here. And how this works is it's going to immobilize the ankle and the foot. And it is used very specifically for more severe injuries. So think about acute fractures, stress fractures, acute Achilles tendon ruptures while you're healing it. You also have severe ligamentous disruption, so a really severe ankle sprain or a high ankle sprain. And it can also be used post-op in a lot of ligamentous post-op reconstructions. And then the last area is cartilage damage in the actual joint. So some people can actually get an osteochondral defect, and the treatment for that is immobilizing the foot. This here is preventing you from moving your foot and ankle. It is offloading the joint. We are doing it on purpose to allow things to heal or to allow things to stiffen up or to allow fractures to heal. So very specifically, this is not something I recommend you just pick up over the counter. We're going to have a reason to put you in this brace. So it's prescribed by your orthopedic physicians. I don't want you to be putting yourself in an air cast if you don't need it because it will also stiffen up your joint. So make sure that the indication is right prior to getting one of these braces. So next we have heel cups. So I'm going to put a picture of a heel cup to the side. So these heel cups are actually put in shoes typically for people who are experiencing Achilles tendon pain and some plantar fasciitis. The heel cup provides a little bit of extra lift to help shorten the Achilles tendon, which takes off load, but it'll also provide a gel base of support. So for people who are experiencing fat pad syndrome, plantar fasciitis, a little bit of pain along the heel as well. It can be quite effective when they put them in shoes. This here is actually a specialized Achilles tendon sleeve. It's not something I commonly recommend, but it's one that was available to me that I wanted to show you. So what this does is it actually stabilizes the ankle joint, but it also provides a lot of stability along the Achilles here. And this is actually given with heel cups, because when the Achilles tendon is really sore, you actually want to lift the heel slightly to help shorten the tendon, to take off load from the tendon, to decrease symptoms and allow it to heal. So what this does is this has got compression over the area that provides an added level of proprioception, but it also has some gel pads that will massage the tendon to provide some increased blood flow and relief. And then the last thing that it'll do is with this heel lift, it lifts up the back part of the heel so that the tendon is shortened so that it can actually offload the tendon to allow it to heal. So this can be quite effective. Think in your Achilles tendinosis or your Achilles tendonitis. I do not use this for Achilles tears. Achilles tears need a walking boot. Now let's move on to the foot. So let's move on to toe spacers. So you got the correct toes, which is a branded version of toe spacers, and then you can get these no-name silicone versions as well. What are these used for? So these are really helpful for those with basically hammer toes, squish toes, bunions, tailor's bunions. There's a lot of evidence coming out that's saying that our ability to splay our toes increases blood flow to the entirety of the foot, helping us to stabilize better, to create better tissue, to reduce plantar fasciitis, to reduce Achilles tendinosis, and these can be quite effective. So I recommend people wear these in and around the home, and sometimes you can actually get shoes where you can fit these toe spacers into. It's very effective at reversing bunions, at helping to treat them in many cases, and it's a non-invasive approach to it. And last of all, we have something called the metatarsal pad. So I'm actually going to show you what it looks like in an insole. So the metatarsal pad is a small little pad here that is put just behind the ball of the foot. So why this is helpful is in people who are experiencing metatarsalgia, which means that they're having pain in the ball of their foot. This provides added support so that the ball of the foot does not have as much pressure being placed on it. So what conditions can this be used for? Metatarsalgia, capsulitis of the second toe, for example, recovering from a stress fracture after you've booted it for a period of time, patients who have a Morton's neuroma, and it can also be helpful in those who have very flat, fallen feet. So this is a very easy thing that you can buy online on yourself, and then you can actually apply it to your insoles on your own as well. But very specifically, you're going to want to look at a YouTube video on how to apply it because it's applied behind the ball of the foot, not on the ball of the foot. And last but certainly not least, you can K-teep many of these areas that I showed you bracing for. In many cases, patients don't like the bulkiness of braces or don't need that added level of support. The nice thing is you can put this on and then put a shoe on. You can put this on and then you can compete with it. So this is always something to be aware of, and a good therapist can show you how to tape for the condition that you're experiencing. So that summarizes the various ankle and foot braces available to patients and what conditions you may want to consider each for. If you have any questions or comments, leave them down below. For now, that's all.